70% of Americans have now rolled up their sleeves for a COVID vaccine, but it's not enough. The latest on the deadly mutations fueling the surge. Plus, COVID breaks through the U.S. Senate. Lindsey Graham is positive for the virus days after sharing the same space with several of his colleagues. Now he's crediting getting vaccinated for not being more sick. Joining us now, the director of the National Institutes of Health, Dr. Francis Collins. And Dr. Collins, thank you very much for being on with us this morning. I'd like to ask you about the unvaccinated population, what the numbers look like to you in terms of the danger that mutations could start being created from the Delta, mutations that are worse than the Delta because perhaps they break through more to people who are vaccinated.
Well, there's an immediate concern even before we think about new mutations. The current one, the Delta variant, is a big threat to those unvaccinated people. This is, as has now been said, a pandemic of the unvaccinated, where we are seeing cases rise now over 100,000 a day, which we have not seen in many months. But yes, you're right. Each one of those new infections is an opportunity for this virus to pick up additional mutations. And while right now the vaccine work really well against Delta, make no mistake about that. The vaccines are highly effective. If in the future some additional mutations pile on here so that the virus is really turning out to be quite different than where we started last year in the Wuhan outbreak, then we could face a moment where the vaccines are no longer as effective, and that would be a world of hurt. So all the more reason why it is critical now for vaccine levels to go up. And I'm glad to see they are, especially in places hard hit like Louisiana, which has tripled their vaccination rates. But we got a long way to go there in some of those places that are only at about 30% coverage.
Could you reinforce to our viewers the impact the Delta variant has on the younger population, on babies and children? How dangerous is it for them?
Thank you for raising that. I think there has been this general sense over the last year and a half that young people don't have to worry about this. Look at what's happening now. We have many 18 and 20-year-olds in ICUs, on ventilators, even babies in pediatric ICUs in Louisiana. So while the attack rate for younger people is lower, it is not zero. And all the more reason, therefore, that anybody who has access to the vaccine, which is anybody over 12, ought to be taking advantage of it. And those people who have kids at home who can't be vaccinated because they're too young need to be thinking about how to protect them with the unpleasantness but necessary step of mask wearing.
So, Dr. Collins, let's talk about people of faith for a moment. You're a man of faith, and you've talked about it publicly before. I actually saw Franklin Graham a bit surprised by his tweet, but he tweeted encouraging people to go out and get vaccinated, said he was absolutely flummoxed by the fact that so many evangelicals were not getting the vaccine. I'm curious what your thoughts are on what responsibility pastors may have, not only in the white evangelical community, but also pastors who may lead churches that are predominantly filled with people of color. Those two areas seem to be obviously significant areas of concern for us. What's the message that pastors should deliver members of their flocks about this vaccine?
I'm glad you're bringing this up, Joe, because I do think they're in a place of incredible importance as people who have respect in the community, who are really trying to do the right thing for their flocks, not to be quiet about this. I do hope, I'm glad you mentioned Franklin Graham. That podcast is up there where we had a good conversation about this. His grandfather was a surgeon in China, so he knows something about medicine. Skeptics from the evangelical community, I hope, are listening to that. I'll be on the Christian Broadcasting Network this afternoon trying to spread the word about the safety and efficacy of vaccines.
Fantastic.
But, I'm a guy from the government, so wouldn't it be better if the guy at the pastoral role was able to come forward from the pulpit and say, people, I've looked at this information. This is a gift from God. You should not think about these as some have claimed as the mark of the beast. By the way, that one is pretty scary. This is a gift from God. This is an answer to prayer. If you want to save your life and that of your neighbors, it's also an opportunity for you to love your neighbor by getting this vaccine. Those messages are all really religiously strong, and pastors ought to be comfortable making them, even though they're going to get some pushback from their congregations.
Dr. Collins, it's Willie Geist. I'm curious about what you think about the future of FDA approval. What we've heard from some people who haven't got the vaccine and have said, hey, this isn't even approved by the FDA, and maybe when it is, I'll feel more comfortable getting it. We'll see if that actually holds out to be true or if it's just a group of people who will never get it. So what's your sense of how soon that may happen?
Well, I've spoken with Peter Marks, who's the person who oversees this at the FDA, just in the last few days. They are flat out 24/7 pushing this approval process. And I don't think there's much doubt in anybody's mind that approval will be granted to Pfizer and Moderna and J&J, but they have to do this by a very rigorous process. And you don't want somebody to come back afterwards and say, oh, they cut some corners here. You want this full approval when it happens to be absolutely airtight. I don't know what that timing is. They're not making a commitment about that. I hope it will be in the next few weeks, and it will probably encourage a few more people. But if you're one of those people listening to this who's holding out for that, this is not a good moment to wait with Delta going crazy in some parts of the country. And with the almost certainty that these approvals are coming, hey, get off the fence, roll up your sleeve. It's time.